Yes, ma'am, we are live now.
Good evening, dear doctors. My name is Dr. Aishwarya, and I welcome you all for today's webinar. The topic for today's webinar is emerging role of ivermectin in the prevention and treatment of COVID-19. It gives me absolute immense pleasure to welcome a very renowned doctor, Dr. Suryakant, as a speaker for today's webinar. Sir is a professor and head of the Department of Respiratory Medicine at the King George Medical University, Lucknow. Sir is a very renowned doctor, and I don't think that these achievements even have to be listed. But to just list them out, Sir is an honorary professor, IMA, National Vice Chairman, IMA AMS, member, Institute and Governing Body at the AIMS Patna, President, Indian College of Allergy, Asthma and Applied Immunology, past President, Indian Chest Society, past President, National College of Chest Physicians. I request Sir now to take over the session. Thank you, sir. Sir, could you please unmute yourself, sir? It's on mute.
Sure. Thank you, Aishwarya. And of course, thank you, Jidus, for providing this wonderful academic evening platform for interacting with the, of course, so many doctors logging on this platform. So a very good evening to all of you. Can I share my PPT?
Yes, sir.
Okay. So not from the various reports coming from the India, but also coming across the world, that ivermectin has played as a game changer in the management of COVID-19, and not only management, but the prevention also. So how it happened and what is the story of ivermectin? Because when we started the COVID-19 pandemic, we talked of most of the hydroxychloroquine. And then, of course, then era came a big, I would say, boom came for the plasma therapy. And of course, after the plasma therapy, then, of course, remdesivir. Then a lot of reports came that remdesivir is not, of course, able to reduce the mortality. So later on, the reports coming that ivermectin not only a safe drug, but it's a wonderful drug. So now coming to today's topic, that is the emerging role of ivermectin in the prevention and treatment of COPD. You see COVID-19 virus, I would say, because of course reported first time in the form of various unknown pneumonia in Wuhan city, China, and that's why later on it labeled as COVID-19 virus, because it was discovered in 2019. But commonly it is called coronavirus. Very popular name is the coronavirus. It is called corona because in Latin corona means crown, and the virus has crown shaped appearance. You can see the beautiful coronavirus appearance, but however it's not beautiful, it's very dangerous. These are the variable viability period of viruses on different surfaces. I used to say from certain hours, from hours to weeks, it can survive on various surfaces, including it can survive 8 hours in the air, on the copper surface 4 hours, cardboard 24 hours. On very surprisingly, shoes and chappals, it can survive up to 5 hours, and in water and sewages, it can survive up to weeks. The latest epidemiology, this is the today's data, and today's data says that India is on the second of the list of coronameter of the globe after the USA as far as the total cases are concerned. However, it is ranked third as far as the mortality is concerned. So our mortality profile is very relatively low, I would say. And if you see the mortality per million population, it is very low as far as the various top 10 countries are concerned. I used to say the way of spread of infection for the COVID-19 in a very simple terminology, it can spread by 3 ways. संक्रमित व्यक्ति से संक्रमण हो सकता है, संक्रमित वायु से संक्रमण हो सकता है, संक्रमित वस्तु से संक्रमण हो सकता है. So it can be spread from man-to-man transmission via aerosol and via fomites, infected fomites. And if you see, the incubation period is between 2 to 14 days, and the spectrum of these severity spectrum profile can be from asymptomatic to symptomatic. Roughly, our Indian profile has shown that 50-50 ratio, 50% are asymptomatic, 50% are symptomatic. And out of the symptomatic, the ratio, the profile can be the mild symptoms, moderate, and critical illness. Mild is usually 81%, moderate to severe is 14%, and critical illness for those who require ICU facility or ventilatory facilities around only 5%. So that is the ratio, that is the profile. And if you see the common symptoms, the common clinical features at the onset of illness, fever is the most common symptom. However, a lot of other symptoms, they have been reported in literature till date. I will not go into the detail, but I would definitely go into the detail of this slide, this PowerPoint. I love this slide because I have prepared with very UC interest, because this is the time in India, that the time of common cold also, flu also, and of course COVID also. So how will you differentiate from these three very common ailments during the winter months? The common cold, flu, and coronavirus. Remember, three symptoms: the fever, the dry cough, and difficulty in breathing. They are very much peculiar for the coronavirus, although every influenza-like illness should be investigated for COVID-19. But remember, every common cold is not COVID. And I used to say for last 9 months, if you see my videos of March or April, then you will find a very common saying from my side when people used to call me or call any doctor, Doctor साहब छींक आ रही है, जुकाम हो गया है, कोरोना तो नहीं हो गया है. So then I used to say, जैसे हर चमकती चीज सोना नहीं होती, वैसे हर टपकती हुई नाक कोरोना नहीं होती. So we don't have to fear that every cold is COVID, but anyway, you have to watch on the symptoms, especially the severe symptoms. Now, if you see the complication, yes, respiratory and non-respiratory complication can alarm the situation of the patient. Of course, can warrant for the admission in ICU facility or requiring for the ventilatory facility. Respiratory complication can be acute respiratory distress syndrome or pneumonia. Non-respiratory complication can be septic shock, acute kidney injury, disseminated intravascular coagulation, rhabdomyolysis, acute cardiac injury in form of pulmonary myocarditis, and arrhythmia. For the diagnosis, again, I would repeat the three important symptoms: fever, cough, and shortness of breath. And two samples are being corrected. One is for nasopharyngeal sample, second is the oropharyngeal sample. And the sample requires storage of 2 to 8 degrees centigrade for the RT-PCR and TrueNet. For antigen test, you don't require any storage. You can do then and there only. And of course, if you see the treatment till date, we have a lot of treatment things in our treatment basket. So the only problem is there is no new drug available for COVID-19. So you cannot say that yes, this drug has been is specifically discovered for the management of COVID-19. We are repurposing the drugs which are already used for other diseases. And these are, to begin with, I would say in sequence: hydroxychloroquine, azithromycin, ivermectin, remdesivir, favipiravir, oseltamivir, topivavir, other therapies in the form of plasma therapy, stem cell therapy, therapies recommended by Ayush department, that is the Ayurveda, Siddha and homeopathy department, in the form of kala, steam inhalation, yoga, pranayam, water, warm water and liquid, etc. But if you see out of these treatment modalities, the ivermectin has become very popular. Why it has become very popular? There are, of course, certain backgrounds. And in nutshell, I will in next 20-25 minutes, I will discuss what are these reasons why this ivermectin has become so popular. Now, if you see the historical story of ivermectin, from soil to worms, in late 1970s, two important scientists, the doctors Satoshi Omura, a microbiologist from Japan, and William Campbell from USA, they jointly discovered this drug. And basically, the purpose of discovering this drug was the antimicrobial, of course, the worm effect of this drug. In 1981, this drug was first introduced commercially for use, and so the globe has 40 years of experience for using this drug. FDA approved drug, the choice for various parasitic diseases in humans as well as in animals. And the list is long. So many parasitic diseases they have been treated successfully, including the onchocercosis, strongyloidosis, head lice, scabies, trichuriasis, ascariasis, filariasis, loa loa, and rosacea, and so many others. And that's why the reason that to, of course, appreciate their work, Omura and Campbell won the Nobel Prize for the Physiology and Medicine in the year 2015. So from 1970s, end of 1970s till 2015, this drug has already attained a great height because when, of course, these two scientists, they awarded the Nobel Prize. So what are the known facts about this drug? It is commercial. It is in commercial use since 1981. So almost 40 years of experience the globe is having. Low cost, very low cost, high efficacy and safety. Safety issue is a very important concern for this drug. No drug which we have used in last 9 months is too much safe as this ivermectin is. Marked tropism for helminths. So basically it is popular drug as anti-helminthic, included in 21st WHO's list of essential medicine in 2019. Easy availability, available everywhere, including the developed countries and developing countries, no resistance to this drug. So these are the certain qualities which have made this drug popular. That's why it is now called as wonder drug. A lot of disease I will not repeat. So for these various worm infestation, this has been used successfully, and that's why it is called wonder drug. Now, these are the potential modes of antiviral actions of ivermectin. It has got antiviral effect, it has got antiparasitic effect, it has got anti-cancerous effect, and it has got immunomodulatory effect. So these are the 4 important effects of this drug. So that's why it is called wonder drug. And if you see its antiviral effect, from it is working, it is effective, ranging from Zika virus, influenza virus, so many other, including the HIV, chikungunya, dengue, etc. So many Japanese encephalitis virus. It is effective, of course, against so many viruses. Now, if you see what are the various modes of action, then of course, the number 1 is the inhibition of viral replication. And it has been seen that in vitro exposure of this drug to the virus, that is coronavirus, it can lead to 5,000 times reduction within 24 hours. 5,000 times reduction in viral numbers within 48 hours, 24 to 48 hours. So it basically inhibits the important alpha and beta 1 transporter protein, which decreases the translocation of the SARS and so many other coronaviruses. So second mechanism is the blockade of the entry of the virus into the host cell. So it prevents entry from, of course, into the host cell as well as the host nucleus. So it inhibits at both sides, as well as cell wall, as well as nucleus. And it action also as an ionophore molecule. Prevention of microvascular thrombosis, because thrombosis is a very important pathological complication of the COVID-19 virus. So it can also prevent the formation of microvascular thrombosis, and that's why it can prevent the complications also during the treatment. The last but not the least, the action is the sequestration in the pulmonary tissue. It can reside, it's a concentration in the pulmonary tissue, because COVID-19 complications are the mainly pneumonia and ARDS, which are the site of the lung. And inside the lung, inside the pulmonary tissue, its concentration is 3 times more than the other tissues and even in the blood flow. And it has got the prolonged residence time, means it can stay in the pulmonary tissue for a longer duration. So that is the beauty of its mechanism of action. Now, a lot of in vitro studies, these are the results of in vitro studies. This shows against this COVID-2 virus, SARS-CoV virus, it means similar type of coronavirus, because a lot of coronaviruses, they have, of course, endemic or pandemic disease in last 20 years. 21st century will be known for the coronavirus diseases later on, when the history of the viruses infection will be written. So by 48 hours, effect increased to an 5,000-fold reduction of viral RNA in ivermectin treated compared to the control. And no toxicity was observed with ivermectin at any of the concentrations, including the 10 times concentration the drug has been used, and no toxicity has been observed. So it's a highly lipophilic, rapidly absorbed, strongly binds to plasma proteins, undergoes enterohepatic circulation, has propensity for the secretion in tissue, resulting in longer terminal half-life and shorter distribution half-life, therefore a prolonged mean residence time in the host associated with persistent effect in vivo. Now, as far as the uses is concerned, in terms of doses, these are the safe permissible dose of ivermectin. We are not using this drug in the children. So below 2 years, it is not used. In pregnancy also, it is contraindicated. So it cannot be used in pregnant women, breastfeeding women, and the children less than 2 years. So it is not allowed the children weighing less than 15 kg or the age is less than 2 years. But above that, it can be used. For example, in 15 to 13 kg children, it can be used as a 6 milligram per day stat dose. 31 to 60 milligram per kg, 31 to 60 kg weight band group, 12 milligram per day. 61 to 90 kilogram weight band, it can be used up to 18 milligram per day. And more than 90 kg weight band, it can be used as 24 milligram per day. It is usually given 2 hours after meals. So usual dose is the bedtime. So after 2 hours of the dinner. Avoid the citrus juice, milk, and alcohol in the night. Careful in the liver diseases and seizure disorders. So be cautious in certain diseases. Contraindicated in pregnancy, nursing mothers, and children below 2 years. Now, what are the adverse effects? Although it's a very safe, however, these adverse effects have been reported in the literature, and one must know, one must be cautious. Latest, they have been reported in drugs 2020, July 19. The commonly are the asthenia, abdominal pain. So common are the GI ones: anorexia, diarrhea, nausea and vomiting, dizziness, pruritus, somnolence, constipation, and tremors. Rarely, certain neurological side effects are also seen, like unable to walk, depressed level of consciousness or loss of consciousness, seizure disorder, convulsion, encephalopathy, coma, or tremor. Ivermectin can be used safely even with 10 times of usual dose. However, you should remember the, of course, neurological patients of neurological diseases, because it can cause serious neurological side effects. So what are the contraindications? Of course, for seizure disorder, any patient of seizure disorder, pregnant women, women with breastfeeding, children less than 2 years, and ivermectin should also be given with caution in severe asthma. Uncontrolled severe asthma and severe liver diseases cases also, in such situations, they should also be avoided. Now you can use ivermectin in combination. If you think, there are a lot of people, and the debate is still going on globally as well as in our country also. When we published the white paper, a lot of criticism came that why Dr. Suryakant and so many 18 experts in this India. So 18 experts of the country, they written a white paper and published, and later on the story, I will tell you the white paper. And then we faced a lot of criticism also, but we also recommended for the mild cases. But if you feel that you want to strengthen your treatment protocol, so you can combine with ivermectin and doxycycline. They have got synergistic effect, and thus the uses of ivermectin and doxycycline combination is a good choice in prevention and management of COVID-19. Combination of ivermectin can be done as a triple combination also, and wonderfully it has been used in the Australia protocol. So other than India, the Australia is another country which is using immensely the ivermectin and has got, of course, very important achievements as far as the prevention of COVID-19 in Australia is concerned. Australia is not in the top 10 countries as far as the world chronometer is concerned. Ivermectin, doxycycline, zinc triple drug therapy is possible because of the following actions: inhibition of spike ACE2 and thereby blocking the virus entry inside the cell and nucleus. Chelation of the zinc and immunomodulatory property. So zinc also has got immunomodulatory property. Inhibition of the viral RNA replication within the host cell. Ivermectin can also be, those who are in favor of hydroxychloroquine, because first time when the President Donald Trump propagated for the hydroxychloroquine, a lot of hydroxychloroquine, and India was the country which supplied hydroxychloroquine to so many countries of the world, including the developed countries like US. But later on, it has been found in our King George Medical University study also, when we found that 17% of healthcare workers developed some other kind of side effect with hydroxychloroquine, and that's why we discontinued since June, July. So we, after June, July, we did not use hydroxychloroquine in our medical university. So, but you can use, those who are in favor of hydroxychloroquine, they can also combine the hydroxychloroquine, their choice drug, with ivermectin. But a lot of human trials are also shown results. So we have discussed the in vitro studies, and then of course the doses, contraindication, all this profile kind of thing with ivermectin, the history of ivermectin, now coming with the human trials for ivermectin. And this study have shown the lower mortality in the treatment group, 15% versus 25%. Mortality was also lower among 75% with severe pulmonary disease treated with ivermectin, 38% versus 80%. Another trial that is called Bangladesh study, and this Bangladesh study has shown the by 55% and 23% patient in group A and B respectively gained symptomatic recovery. The group A was the ivermectin group, group B was the control or placebo group. And the adverse event profile of this Bangladesh study shows 31% versus 46%. So it is relatively safe. In this study also, another study that shows requiring the mechanical ventilation use, the fewer patient died in the ivermectin group, 7.3 versus 21%. Overall death rates were lower than the ivermectin, 1.4% versus 8.5%. So it reduces the mortality, it reduces the severe hospitalization duration, and it also important as far as the prevention is concerned. We will come later on regarding the prevention trial. Now, these are the 8 ongoing trials in India, including the AIIMS New Delhi. AIIMS New Delhi trial is wonderful because it is basically the doses debate is also there. We faced a long debate with doses, and AIIMS New Delhi is undergoing one trial where the arms one has got 12 milligram dose per day. Another arm is having 24. So dose is basically ranging from 12 milligram to 120. So the 5-arm study, this 5-arm study using the various kind of doses as far as the use of ivermectin in therapeutic purposes is concerned. One study is also going on in Ujjain, that is the prophylactic study. So these are the 8 studies going on in other various parts of the country. And if you see the clinical trial status of ivermectin globally, then 39 trials they are undergoing. And of course, some of the results are available slowly and slowly. We are having watch on these trials for results to come. And of course, one can go on the clinical trial registry website, regarding all these trials. And these are the 39 trials. And the Singapore has got very important prophylactic trial also, preventive treatment for the migrant workers at high risk of COVID-19. Now, recent trials are also showing promising results, including from India. Now, this is the Dhaka study, very important for the prophylaxis study that we were talking of. That was the treatment study. This is the prophylaxis study, and this shows the statistically significant protection against the COVID as prophylactic drug. So this is, the results are coming, although not published. This is a pre-published study, but it is, the results are available. The second study from India, the Bhubaneswar AIIMS Bhubaneswar, established in 2011-12, although its proposal was passed in 2004 when Sushma Swaraj was the health minister and Atal Bihari Vajpayee was the prime minister. Later on, it was established and started in 2012. And this AIIMS Bhubaneswar study has shown 73% reduction of COVID-19 infection among the healthcare workers for the following 1 month. So that's also important result. Now, coming to my state, that is Uttar Pradesh. So we were the expert behind the framing this GEO. And this GEO, UP has become the first state, not only in India, but throughout the world, that any state as a part of protocol, as a GEO has issued, has shown the faith on ivermectin. So this GEO was issued 6th August 2020. And my dear friend, you will be surprised to listen that I personally signed this technical expert committee report on 5th August. And you will be surprised to know the kind of speedness, the kind of promptness of the UP government. The geo came just another day on 6th of August. Yes, my dear friend, you have listened rightly. I signed personally as an expert the report on 5th August evening, and 6th morning the geo came. So now you can see the concernedness of Uttar Pradesh. So UP has become the leader. This is the geo, and you can see from a distance also my signature, because this is my habit. For Hindi paper I used to sign in Hindi, and you can recognize very well my signature in Hindi. Now what this geo says: as per the government of Uttar Pradesh, dated 6 August 2020, we are using this drug for prophylaxis as well as the treatment. For prophylaxis, day 1, day 7, and day 30, and monthly, then monthly 12 milligram OD for all healthcare workers. And in our King George Medical University, we are following. Personally, I am also taking this drug. And with God's grace, I would not say with ivermectin, with God's grace, with your blessings, I have tested 3 times and all 3 reports are negative for me. I have never developed COVID-19. So the second prophylaxis is for the household contact of the COVID-19 patient, day 1, day 7, day 12. This is for the public. So all the people for household contacts means all family members in which one patient has found to be COVID positive. For the treatment purposes, the dosage is 12 milligram OD for 3 days, along with the tablet doxycycline 100 milligram for 5 days. This is for treatment purposes, for the mild cases and asymptomatic cases. We have not used in Uttar Pradesh for moderate to severe or critical cases. The second government was the Assam government, which included the ivermectin after the Uttar Pradesh, and same kind of course, the protocol included the zinc was also included in the protocol. Another along with the vitamin C and D, and the same kind of protocol including the ivermectin and doxycycline was there. The third government is the West Bengal, which included this ivermectin. This is in the month of course, 29 September. So 2 months back. Now this I was talking of the white paper on ivermectin. You see, before the geo camps, the geo basically dependent on this white paper. So 18 experts from the India, of course, interacted with each other on the online webinars, online platform, and they ultimately ending into a conclusion. And this white paper came into the existence. So this is the white paper on ivermectin as a potential therapy for COVID-19. And later on, we were surprised to know that one day my friend from Mumbai called me, Dr. Surikant, you are on WHO website. I said, what? That your white paper is now, of course, the WHO website is showing our white paper. So our white paper gone on the WHO website. I don't know how many things they have gone on WHO website. So this is the WHO website, and you can see the white paper on ivermectin as a potential therapy for. Out of the 18, I was lucky enough that my name was there on the front line of the white paper, the WHO website window. So that's why people recognize me, and then of course called me, and then of course this news spread throughout the country and so many other countries. Then we getting enthusiasm from this. Then we published another article in a journal, which is the Journal of the General Physicians, and more than 5 lakh doctors. For more than 5 lakh doctors, this journal is being circulated in Indian Journal of Clinical Practice. And then we published this article in the October issue. So this is ivermectin, a potential weapon in the anti-COVID-19 armamentarium. So after this publication, of course, then we thought of that the news should go, of course, in the term of prophylaxis also. Then we again, experts of the country, of course, met on the online platform. And then we created a consensus statement on ivermectin prophylaxis. And this is published latestly in the JIMA. JIMA is the Journal of Indian Medical Association, which is the largest medical association of the doctors in the world, not only India, Asia. It is the largest organization of the doctors in the world. And this published the prophylaxis consensus statement on ivermectin prophylaxis published in JIMA in December last month only. So this is the drug corner of the Journal of the Indian Medical Association, and you can see here the ivermectin as a chemoprophylactic agent against COVID-19, a consensus statement. Again, you find that more than 15 experts from the country they published. They are the contributing authors for this paper. Now, a little bit about the prevention, because you have, of course, gone through the power of the ivermectin for prophylaxis and treatment, but we should never forget the prevention of COVID-19. And this is the one slide which I used to love, because this will continue in 2021 also. Still, we are only 1 week ahead of the vaccination program in India. It will be the largest vaccination program of the 21st century for a viral disease throughout the world. So India is leading. India has become the third country to develop the 2 vaccines in the country, along with the US and the UK. These are the 3 countries which have developed 2 vaccines for COVID-19, and so many are pipeline. The Zydus is one, which is the racing behind a little bit. I think with next month, the Zydus people will also come with the vaccine. The namaste, we have to meet. When we have to meet, we are meeting, we are greeting each other. So meet and greet is the pattern policy of any interaction. And we continue to do namaste. We should not hug, we should not embrace each other. We should continue namaste still in 2021 also. And I would recommend that in future also. Physical distancing, yes, we have to maintain the physical distancing even after the vaccination program. Shoes, chappals should be take off at the entry of house. Hand wash, frequent hand wash. Whenever you get the opportunity, you always hand wash. जैसे आप निकलते हैं तो चाय कहीं मिलती है तो अपने आप चाय पीने की इच्छा हो जाती है. इसी तरह जहां वॉश बेसिन दिखे वहां हाथ धोने की इच्छा आप जता लीजिए. जहां सैनिटाइजर दिखे वहां सैनिटाइजर से हाथ धोए. Make it practice like this. You should be tempted to hand wash whenever you see the wash basin or a paper soap or a sanitizer. Wear mask when out of home. Diet and nutrition is a very important, and that's why I'm debating on one issue. If you want your child as an immune child, so make him vegetable child, not the burger child. So debate is going on whether you want an immune child or non-immune child. If you really want your child as an immune child, then go for make him vegetable child, not the burger child. And of course, the Ayush ministry has recommended so many things for improving immunity. That is meditation, yoga, exercise, good sleep, no addiction. So smoking, alcohol, and all addiction, they are lowering the immunity, and that's why we should not use them. Sanskar, respect and care of seniors, senior citizens, passionate environment at home also create the immunity. So we should think of this homely environment. Work from home and work at home. Work off home. It's very important, not only that most of the people now working as from home, but they should also get involved for the work of home. They should share some contribution for the work of home. Teleconsultation, the COVID-19 has, of course, taught us the doctor fraternity for the increased power and, of course, immense utility of the teleconsultation. And that's why we should continue to. We have learned this teleconsultation and we should continue it. A lot of doctors now doing the video conferencing or teleconsultation. They are not doing physical consultation. And I think, for example, the psychiatrist, skin specialist, they are not touching the patient. Have you ever seen a skin specialist touching or doing examination on patient? So why you require the physical attendance? All these specialists, they should do teleconsultation. Psychiatrists, they only talk. So you can talk on video. Appropriate measures for airborne infection control at clinics and hospitals. This has become a latest awareness, which we were ignorant prior to COVID-19. PPE kit and N95 mask during the procedures. So we have to take the extra precautions while doing any procedure, any simple procedure, dressing, intercostal drainage, fluid fluid aspiration, ultrasound, CT scan, so many investigations, so many procedures. So we should use appropriately PPE kit and N95 mask. If you see, the COVID-19 has given the status of the Prime Minister Narendra Modi as a world leader, the world most famous leader. Latest US survey shows that now Prime Minister Narendra Modi is the #1 global leader. Why? Because he has taken a special interest in COVID-19, and he started with the Jan Jagran when we demanded people for Thali and Thali. People laughed, opposition laughed, why Thali and Thali? But that was the public awareness program. That was the involvement of the public for the prevention prophylaxis and respect to the healthcare workers. That was a good initiative which was followed by globally also. So he started with Jan Jagran in the month of March, April, and to Jan Andolan on 8th of October, he said that everybody should participate in this Jan Andolan. And as a part of this feature of Jan Andolan, he said, कोरोना से बचें, हाथ धोएं, बार-बार हाथ सही से मास्क पहने, निभाएं 2 गज की दूरी, एंड जब तक दवाई नहीं तब तक ढिलाई नहीं. लेकिन अब वैक्सीन आ गई है तो उन्होंने कहा दवाई भी और कड़ाई भी. You will be surprised to know this is our department photo. The patient performing yoga in the yoga room department of respiratory at King George Medical University. We are the modern medicine university, the oldest university in the northern India, established in 1905. First batch of MBBS came in 1911. And I'm proud enough that I was a part of this university since so many years. I did my MBBS, MD, senior residency, and then become faculty member. And for last almost 9 years, I'm heading the Department of Respiratory Medicine at King George Medical University, Lucknow. And still we following this because the evidence-based medicine now says that pranayama improves not only the general immunity, but specifically the lung immunity. So here's some ideas to stay healthy: be active, eat healthy, don't smoke, don't drink alcohol, meditate, read books, listen music, and of course, respect for the seniors. In conclusion, I would say that ivermectin exerts broad-spectrum antiviral activity against several animal and human viruses, including the both RNA and DNA viruses. The antiviral potential of ivermectin against the various viruses is mediated through complex mechanism involving inhibition of nuclear trafficking of the virus. While the treatment guidelines using ivermectin has been established in some states in India, various trials are underway in India and worldwide to establish doses and clinical efficacy. Over 100 vaccine trials are going on in the world for this novel coronavirus disease. 2 vaccines have been approved for emergency use in India. In first phase, around 1 crore healthcare workers will be vaccinated. Although vaccination is going to be launched within a week, however, vaccination of about 100 crore people, which is the usual target for India, because if you just exclude the children and pregnant ladies, of course, the target will be around 90 crore or 100 crore. People will require about 1 year. Just so in single day, in single night, in single month, in single week, you cannot vaccinate 1,000 crore, 100 crore people. So whole 2021 will be, of course, the vaccination year. Even after the vaccination, everyone has to follow the COVID prevention protocol. And that's why our Prime Minister said, Dawai bhi, kadai bhi. Immunity and prevention are the best social vaccines. So although biological vaccines are available, still you have to follow the social vaccines. The important aspect are the immunity and the prevention. So continue to protect our fraternity as well as community. Dosto, khatra abhi tala nahi hai. Thank you very much for providing this wonderful immunity for opportunity. And I would love to answer any queries. So please continue to ask the questions. I'm here, very much here to answer your queries. Or if any suggestion, please give the suggestions also.
Thank you so much, sir. Thank you for the wonderful, well-executed session. We all really enjoyed. Indeed, it's a privilege to hear from you, sir. We do have questions from the audience, which have been sent to you, sir. Do you want me to read out to you, sir, or do you want to read out yourself, sir?
Okay, so I'm having the chart of these questions. Dr. Deepesh Bishwas from Patna. He says, vaccine will come. Should we continue giving ivermectin prophylaxis doses to the patient? Yes. Why not? You see, vaccine does not prevent the entry of virus inside the host. It increases the immunity. So still we are taking the ivermectin prophylaxis. The vaccine efficacy is from 70% to 95%, means 5% to 30% population, vaccinated population will not get protection. So vaccination is vaccination. ये अमृत नहीं है कि एक बार अमृत का प्याला पी लेंगे या 2 बूंद अमृत की पी लेंगे और आप अमर हो जाएंगे. Vaccination will not provide you the entry of virus inside your airways. The another question is from Dr. Ramanpreet Singh, Chandigarh. Why government of India not recommending ivermectin as it is one of the safest drug? There's so many governments. I told in my lecture that at least I know 3 governments, they have included their protocol. We have requested the ICMR also. I think the basically ultimate decision is I'm not part of ICMR. I'm not part of the government of India. So I cannot comment. But yes, if you decide, you come in favor of, if the majority come in favor, why not? When Donald Trump को माफी मांगनी पड़ सकती है, तो ये तो एक छोटा सा ऑर्डर की बात है. पब्लिक का स्ट्रेंथ होना चाहिए इसके पीछे. So come on this ivermectin, make ivermectin more strong, then of course you will get the union order also. Harish Negi from Delhi, he's asking, what is the prophylactic dose of ivermectin? How effective is ivermectin in giving prophylactically? So we have evidence of our Uttar Pradesh, KGMU and Bhubaneswar AIMS study that has been, results have come, it's still going to publish. So results have, it's effective, quite effective. But the only thing is the doses, yes, the doses are very simple for healthcare prophylaxis. It is the 12 milligram on day 1, day 7, day 30, and then once a month. And for the household contact, the doses are only first day and 7th day, 12 milligram one day and then 7th day. The R. Rameshwar from Hyderabad, he's asking about, since there is a less cases of COVID-19 getting reported, should it be right to prescribe ivermectin prophylactic dose? Please share your views. Yes, it should be continued for healthcare workers. Why? Because still the vaccination program is having 7 to 10 days to come. And must clear to all the listeners, all the viewers, that first dose of vaccine will be given, then after 28 weeks, second dose will be given. And then after the 15 days of the second dose, the immunity will start, immunity will rise, the antibodies will start to form. So antibody you will get only after at least 6 weeks of first dose, or I would say 2 weeks of the second dose. So I would say that if you are more confident on vaccine, so is still at least 3 months to go for the ivermectin. You have to continue the ivermectin. And the Ashok Kumar from Indore, he has asked, there any cases of COVID known in a person who has no symptom? Yes. Asymptomatic carrier. You see that if I just talk to new strain, 73 people have been detected in India regarding this UK strain, new strain. And they are the mostly asymptomatic. They don't have any symptom, but they are the carrier. So asymptomatic can be carrier also. And that's why I'm saying that why you should continue the mask, why you should continue all the protocol, COVID prevention protocol. Why? Because even if you are vaccinated, that means that doesn't give you the guarantee that virus cannot enter in your upper airway or lower airway. And suppose you are not diseased, but you can spread the virus. You are getting the virus, you can spread the virus. No vaccine is, of course, effective regarding this entry and exit of the virus. So, my dear friend, vaccine is protecting yourself for not developing it. You see, there are the 3 objectives of the vaccine. Number one, that you should not be diseased. Number 2, you should not have a severe disease. Number 3, you should not have the mortality. These are the only 3 objective of any vaccine, including COVID-19. No vaccine is having objective that it will provide protection for entry of the virus. No. Milind Kamble, how long can COVID survive on inanimate objects like table, chair in a clinical setup? Yes, I said that maximum 4-5 days it can survive. 48 hours is the usual time for surviving on such surfaces. To begin with, I think you have joined late. So to begin with, I showed a slide on what surfaces, how long virus can survive. So usually on cardboard, table, wooden, usual time is 48 hours to 72 hours. Dr. Mohan Babu, what is the efficacy of ivermectin in the treatment of COVID-19 from your practice? So yes, I have not published data. We are in process of compiling and capturing and compiling the data. When we will publish, we will definitely share. But the various, of course, the various trials, published or unpublished, they have shown that it is effective, at least in mild to moderate cases. And it is effective it is more effective in comparison to the other competitive drugs. Muhammad Ali from Mumbai, Can you please comment on the new strain of COVID-19? I think I have already commented new strain. There is nothing, of course, should be panic about the new strain. New strain is basically having mild mutation from the older strain. Mutation is the habit of the all microorganism, including the viruses, including the COVID-19 viruses. So these trivial mutations, they have changed the virus. There is no change in mortality. The only thing is infectivity has increased. You see, for virus, again, three things are important. Number one, power of infection, power of spreading the infection. Second is virulence, means power of creating severe disease. And third is mortality. So the first thing, that is power to spread the infection, this is 70% more with new strain. Otherwise, the serious disease or mortality, this is not affected by this COVID-19. Rather, it is less severe disease. This is creating less severe disease. The only thing is with old strain, suppose one person, the 2 to 3% get infected from one infected person. This was the usual infectivity. But with new strain, the 6 to 7 people can get infected from one infected fellow. So the speed of spreading infection is more with this. Rest of the two, the severity of the disease and mortality, they are not affected by new strain. Rather, the severity of disease is less. Mostly patients are asymptomatic. Is there any other question? I have finished
my
questions.
I think all are done. So thank you so much, sir, for the questions that are beautifully answered by you. We have around 1,160 plus doctors who have attended this webinar. That's the live count I've got, and it's increasing actually. So thank you very much on behalf of Zydus. Thank you very much on behalf of our audience. It is a great privilege to learn from you, sir, and we look forward to learn from you again. Thank you very much, sir.
Dr. Aishwarya, thank you very much. And you can archive at Zydus website or whatever it is, or you can have the later on Facebook spread or the other media like YouTube and so many others.
Yes, sir.
So
thank you, sir.
Those who have missed, the dissemination should be continued.
Yes, sir. Thank you, sir. Thank you very much, sir.
Okay,
we look forward to hear from you.
Namaste.
Thank you, sir. Thank you. Namaste.